Good afternoon, everyone. Thanks for joining us. Sorry to be a couple minutes behind schedule. We wanted to get you caught up and up to date. There's a lot of interesting things going on that we want to advise you of. And as promised, we'll be live with you every Wednesday and Friday. Today is Wednesday. Next Wednesday, we'll be hosting this as a Facebook town hall. But also we'll be hosting our every other week telephone town hall. So hopefully you'll join us again on Friday so we can provide a decent update for you, and of course again the following Wednesday. So as always, I just want to mention and our thanks to our American Sign Language interpreters who are here with us regularly and about 6 feet apart, so that's good news. I think we're 6 feet apart. Do you think we're 6 feet apart? She's not really supposed to talk to me. But we've been doing this so long, I feel like we're family. So join us in saying thank you, and we certainly celebrate your being a part of our presentation. I want to mention that we're joined this afternoon, and we'll get to him in a few moments, but to join this afternoon by Dr. William Begg. Dr. Begg is the Vice President of Medical Affairs for Vassar Brothers Medical Center. And he is going to join us to talk a little bit about the importance of maintaining our health during the pandemic. I know that many we have Dr. Begg right there. Look at that. I know that many have had questions regarding going back to a doctor, a physician, or a hospital. Of course, ours, we can confidently say, are prepared to welcome you regardless of health concern. And Dr. Begg will talk a little bit about that and answer some questions, which reminds me to tell you that if you have any questions, please start typing them in the comment box underneath the live feed, and we'll get to as many questions today as we can. So let's jump right in. You are familiar with, the measurements we've been using, the data dashboard that Dutchess County has available, and the county has available, and you've been following our dashboard online. This series of numbers, let's go through very, very quickly. I will tell you that as of today, Dutchess County has administered 23,195 diagnostic tests. In fact, we administered nearly 1,000 tests just yesterday alone. So I tell you that to be prepared that active and confirmed cases will grow based on testing. We hope and certainly expect, not at the same rate we saw a month ago. But nevertheless, we administered 1,000 tests, almost 1,000 tests yesterday. The other is I want to mention to you that you'll note 3,710 confirmed cases. 1,743 of those are active cases. Yesterday and the day before, we saw a significant jump in those confirmed cases. Most of that data is older data being inputted by the state. We kind of sort of half-kiddingly call it like a data dump. The state is catching up. Part of this is the fact that this county, along with many counties, are now testing patients at nursing homes. The state has initiated a mandate to test staff at nursing homes, and that has added a great number into the system. And that, combined with the ongoing testing going to labs, has slowed down the process of inputting them in the dashboard. But you should know that when an individual tests positive, we are aware of that. We know that there's not a delay in identifying the positive individual. There's a delay in getting the data into the dashboard at the state level, and you'll start to see a little bit of that. But we overall have seen a regular decline in active cases. You'll see that happen as well, that a lot of those additional confirmed cases will almost immediately become recovered cases because some of the data is more than 14 days old. So the state is inputting it as quickly as possible, and of course we're sharing it with you. Now to jump to the state, as you know, the governor and the state of New York has established 7 benchmarks by which counties are measured. I shouldn't say that, by which regions are measured, and the Mid-Hudson region is a 7-county region measured against these 7 benchmarks. And what I want you to know is that we've made significant progress here in Dutchess County. If we were to be measured independent of the other 6 counties, Dutchess has met now all 7 of those metrics. And so, again, only if you measure us independent of everyone else, Dutchess County has met the 7 metrics. Significant progress over the last several days. And at this point, what we are awaiting, of course, is for the entire region to reach that. The region currently meets technically 5 of 7. The reason I say technically is that the state is holding one indicator regarding contact tracers as sort of undetermined until the very end. And counties, and I'll talk about that in a moment, counties across the region and the state are attempting to augment our contact tracing teams. And then once we reach those, we'll be at a full 7 approved, 7 metrics. And Peter's asking, can we open? Keep in mind certain activities are underway, and even in phase 1 is not going to open the doors, if you will, flood open the doors. But we are very close to beginning phase 1 opening here in the Mid-Hudson region. We're still working with the regional control rooms. This is what the governor has established, 7 counties meeting with the state officials every day. We discuss the metrics, we discuss the logic behind those metrics, and we discuss some steps towards implementing the next phase of opening. Now, for us, I will tell you, we are advocating for some new logic, or at least applied logic, to 1 or 2 of those metrics, and we're going to continue to push that. But we are very close, we believe, to achieving all 7 for this region, and we believe that is just around the corner, and we'll keep you updated. Now, mind you, again, as has happened many times, some data or variable could change. Our hospitals cannot be overwhelmed by patients, but we believe we're very close to achieving all 7. Dutchess County has achieved those 7 metrics, and we're now inching closer toward beginning phase 1, if you will, of the incremental restarting of activity in the Mid-Hudson region. We do need some help, and then I'll get to actually, Zach, I'm going to answer your question. Zach asked, how can I volunteer as a contact tracer? Contact tracers are needed for us to take an individual who tests positive, and we contact that individual when they've been identified as a positive test. We ask them who they may have come into contact with, close proximity with over the last period of days. And if they know who those are, they might say, it's my mother, my wife, my cousin. And then a contact tracer is responsible for calling those people, advising them that they've come into contact with someone that they may know who has tested positive, and then we advise them of the steps they should take. They could be tested if they wish. They may want to precautionary quarantine if they wish, but they certainly want to be aware that they came into contact with a positive case, and they act as if they may have contracted the disease. So what I'd offer you is 2 things. One, you can see we need your help both as a volunteer here in Dutchess. We have 92 already dedicated contact tracers. Our goal is to augment our team to include 250 total contact tracers here in Dutchess County. Of those 92, many are county employees, dedicated employees with the Department of Behavioral and Community Health. Some are employees from other departments within county government being assigned that responsibility, and others are members of our Medical Reserve Corps. If you are interested in joining us as a volunteer contact tracer, you need no prerequisite experience. You can work remotely from home. It's a phone call and internet access is all is needed from your home. Frankly, if you feel comfortable making a cold call to someone and explaining to them some modest amount of medical information based on a basic script and some training, we'd love to have you join us as a volunteer. We don't have any more money in county government to hire more people, so we're asking to augment our team through volunteers. And at the same time, if you wish to volunteer with us, you can still apply to work as a paid contact tracer for the state of New York. And when that process is complete, and if you choose to do that, you get hired by the state, you will preclude your volunteer service with us and can go off and work as a paid employee. But if you're interested in volunteering, you should visit DC Personnel or send an email to dcpersonnel@dutchessny.gov. Ideally, your name, your cell phone number, and your email, and we'll be in touch with you to follow up. So you can volunteer as a temporary volunteer, and then you can also apply to be a temporary paid employee by the state of New York. Lisa asked, are there any fun things we can do for Memorial Day to honor all who served our country? As you know, both the governor and the counties did preclude social gatherings. However, and actually the Dutchess County order remains no social gatherings, public gatherings of greater than 10 people. The governor's order now permits that as well. So any VFW, American Legion, can certainly convene, or you can convene as not more than 10 people to pay respects. This is perhaps America's most solemn of holidays. This is, I apologize, I'm trying to do a couple things at once. You can, this is perhaps one of America's most solemn of holidays. And for us, it's a moment to pay respects, of course, to those who died in service to this country. So I offer to you that you can convene, as I said, in social gatherings not more than 10 people. You can visit a cemetery to pay respects to veterans individually, certainly, and lay a flag, or you can participate in Dutchess County's convoy, our Memorial Day convoy. You can see online, visit us if you're on Facebook, you can see it here at the Dutchess County Government Facebook page. And you'll see the convoy, the route, and how you can participate. And we're very grateful to the Division of Veteran Services to have organized that. Marc and his staff to have helped organize that. We're grateful for those who have served this country. And in their sort of final mission of service, it's our obligation to find ways to pay respect to those who died in service to this country. So I want to also mention to you that last Saturday, the county began in partnership with Nuvance Healthcare, began we took down, if you will, disassembled and stood down the recovery center that was established at Dutchess Community College. Thankfully, working together with Nuvance Healthcare, we were prepared for additional beds and additional bed space that we established to allow those who might not need hospital treatment but needed some medical assistance. And thanks to our MRC, our Medical Reserve Corps, and staff at Behavioral and Community Health in partnership with Nuvance, we were prepared to augment the hospital system by having the recovery center available. And with that, we were prepared, but thankfully we never exceeded the need or the capacity, so that we didn't necessarily need that facility. And thankfully, with them, we decided to take it down. So we no longer are concerned about that particular concern, but thankfully we were prepared should we have needed it. Domenica asks, do businesses have to mandate customers to wear masks? There is no business mandate to wear a face covering, but as you know, the governor's instruction and our instruction is that you wear a face covering when you can't engage in social distancing. So in truth, a business could ask you, if you're in a gathering or a business where you're not able to sustain social distancing, they might ask if you have a mask, and they could definitely ask you to step outside. So I just would encourage you to have that face covering on you. And again, there are a lot of things that work. A traditional face mask, if you will, or some other homemade face covering, a scarf, bandana. You can have, if you have access to that, then you'd use that to cover your face, your eyes, your mouth, and your nose if you can't sustain social distancing. Mike is asking when barbershops can open. We believe barbershops fall in phase 2. Phase 2 is professional services that would that certainly couldn't occur before phase 1. We expect to hopefully achieve phase 1 shortly, and then in short order get to phase 2. And then with phase 2, we believe that barbershop salons would fall under that professional services category. However, the state of New York hasn't given clear direction on that yet. So let's talk a little bit about what is permitted currently. Kelly's asking, are there any new businesses allowed since our last Facebook page? I don't know, or since our last Facebook Live. I don't recall what we went over on our last Facebook Live, so I'll give you what we do know. In addition to those businesses you already know deemed essential, Religious services are now permitted either in a parking lot, so vehicle only. Religious services can occur in a house of worship, parking lot where the church leader, the faith leader, can be present to lead in that service, and congregants can remain in their vehicle. Today, the governor allowed or permitted now religious services, isn't that true? Up to 10 people, socially distant. So again, up to 10 people can congregate if you wish for a religious service in person, but you should have face coverings and engage in social distancing. All libraries supported by taxpayer dollars, which in Dutchess I think is all libraries. So any municipal or municipal supported or taxpayer supported library is able to be open if they choose. Limited capacity, social distancing for essential services. They can continue to operate curbside collection as well. Any retail business can have delivery service. So any retail business currently can have delivery service. One employee, one employer in that business, online or phone transactions, and an individual can deliver to. So an employee can deliver to a home or can deliver to a vehicle, but that is what is permitted. Single student, single instructor, horseback riding, we talked about. Fishing and hunt clubs, again, socially distanced, limited capacity. Acupuncturists are now permitted as prescribed, so they're now deemed essential, and that is now permitted. Pet grooming to ensure the well-being of the animal is now permitted. Auto maintenance is now permitted, so not just repair, emergency repairs, what have you, but any auto maintenance is now permitted. Non-motorized boating and those kind of transactions, non-motorized boating permitted. Golf courses and driving range permitted, but no mini golf. I think we've talked about landscaping is now deemed essential in all categories of landscaping. Gardening, horticulture, and outdoor low-risk recreation activities, including tennis, non-motorized boat use, rentals, golf and driving ranges, as we've mentioned, and most notably, I think you know, and I know people are enjoying this, drive-in movie theaters now permitted. All three in Dutchess County are open. All three of our drive-in movie theaters. Overlook in LaGrange, Arlington, or the LaGrange area. Hyde Park Drive-In in Hyde Park, of course, and the Four Brothers Drive-In, which was featured today on the Today Show in the town of Amenia. So if you watch, I think it's Harry Smith on the Today Show, featured the Four Brothers Drive-In, and please take advantage of those. Again, social distancing, limiting that interaction is very, very important. Let's go through a handful of very quick questions, and then what I'd like to do is hand over for a couple minutes to Dr. Begg, and he can talk to us a little bit and take some questions as well. Why is Dutchess County in the same region as Westchester? Number one, because we are, meaning they've deemed that we are. The state of New York has deemed that to be the region. We function somewhat as a region. Yes, there are certain benchmarks where Westchester doesn't necessarily help the region, and then there are certain benchmarks where, frankly, having that large population base does help us. That's the region, 7 counties. We're functioning together. We are closing in on all 7 metrics as measured by the state. What will schools have to do to prepare for next year? The short answer is, all the schools are working with the state education department to prepare. We certainly expect that there will be certain restrictions, but we're hopeful that students can return to a classroom and not necessarily have to live with any overwhelming restrictions. But school districts are working today with our health department and state ed to prepare for a September return, and we are hopeful, and I certainly expect that they will. Michael is asking about day programs like ARC, the Arc of Dutchess. We believe that that's more like the Phase 3 period, meaning an opportunity, a time where you can have a little bit more congregation together. Believe me, we're pushing for that, but we believe that that is likely to be Phase 3, which is also an answer to Rosie's question. A few more weeks until we can dine inside restaurants. Yes, Phase 1 is a modest incremental change. Phase 2 would allow return to some restaurant space, both interior and exterior. That is likely not less than 2 weeks away, more like 3 weeks, 2 to 3 weeks from now. Any guidance on summer school, Heather? What I'll offer to you is that we are encouraging the state to establish a standard that mandates summer school services for special education. We already know that regression is real, and we want kids not to have to experience that. And I offer to you that we really are pushing on the state to make sure that those services are available this summer. There's still no guidance. But again, we are asking, and I certainly understand and appreciate that that should occur. Robert asked about yard sales. I don't know that we know the phase for yard sales yet. I'd have to assume more like phase 3, which is more sort of open access to retail, more group settings, but we'll try to get you an answer on that. Once we're in phase 1, can the metrics push us back to pause? John, the short answer is yes, but the goal that we have in these control rooms is to monitor the data in the hopes that we don't have to take a step backwards, but perhaps just slow some of the next steps. So again, the goal is to project forward what we think the trends are. And as long as we stay in that sort of basic plateau and decline phase, we'll be able to progress rapidly through the phases. Yes, the potential is you could see a spike, or hospitals could become overwhelmed, and there might be a need to slow down again, but the goal here is not to have that happen. And with that, before we take on some more questions, let's jump to Dr. Begg. As I said, Dr. William Begg is the Vice President of Medical Affairs at Vassar Brothers Medical Center. And we wanted to talk a little bit, Dr. Begg, about some concerns that obviously residents have about, in essence, tending to their own personal health. As we know, with the mandatory restrictions in place, certain procedures and access to health care has been somewhat limited. But as we open up again, we have to believe that people might have a degree of concern and anxiety. And what would you share with them right up front about the importance, one, of paying attention to their health, and two, leaning on what is a tremendous healthcare system here in the Hudson Valley?
Well, I want to thank you, County Executive Molinaro, for the opportunity to say a few words. First, I just want to say that I want to thank everyone in the greater Dutchess County area for all you've been through. My prayers go out to those who have lost loved ones during this pandemic. To think on January 1st you could have been through this is unimaginable. If you've been affected by coronavirus, you've been in the healthcare system or struggled at home with it, I also understand or try to understand how much you've been through. For those of you that have just been scared, my goal today is to hopefully give you some input on how we can have you feel safe while the county executive is trying to get you back into some degree of normal life. So my background, I'm actually a practicing emergency room physician in addition to working administrative at Vassar Brothers. I'm really passionate about Dutchess County. My youngest goes to Marist, so I really care about what happens here. I care about you too, and what I'm concerned about is that there's a degree of fear that's actually affecting the health of those in Dutchess County. And while we want to protect ourselves and not contract coronavirus, unfortunately, some people are actually getting sick and dying or having really bad complications from not seeking medical care. Now, as an example, we see heart attacks, and when they come in, they're much more severe. When people come with strokes, they're much, much worse. When people come with belly pain, their appendix already burst. So what I want to give you the confidence that compared to when we first started this pandemic 2.5 months ago, your hospitals are safe. When you come through a doctor's office or go into the emergency room or are admitted to a hospital, we have such scrupulous protocols that you can rest assured that you're not going to contract coronavirus by going to see your doctor. One great example, we tested almost all the nurses that would agree to be tested or that we could test to see what percentage end up having antibodies to coronavirus, means were they exposed? Not one ER nurse that we tested was exposed to coronavirus in the last 2.5 months, which means we paid really close attention to all those details about keeping our staff and you safe. So I will say that going forward, things are going to be different. There's a great opportunity for you to engage in telehealth with your doctor or medical provider. You can get prescriptions, you can get follow-up checkups that way. But if you have some real complaints, your doctor may advise or you may feel the need to go to the emergency room. We want you to stay safe and we want you to feel comfortable that that if you go to healthcare, that you're in a position to be treated appropriately. But County Executive, please, I'm happy to answer any additional questions.
I appreciate that, and thank you. So, we tend to think that that most people know what we're talking about when we talk about telemedicine or telehealth. Could you give some practical, sort of examples that maybe a senior citizen at home might think, I don't want to talk to a doctor over my telephone. What are some examples that maybe the average resident patient might want to take advantage of telehealth, and why that could be very, very helpful in identifying and perhaps even preventing a particular health concern?
Well, as an example, if you have computer access, this would be basically a telehealth exam right now. Oh my gosh, you've had chest pain for 3 or 4 days, you have high blood pressure, diabetes, and cholesterol. I think it's really important that we bring you in for an EKG and have some blood tests and see if you're okay. On the other hand, you may say, geez, I have this little rash, doc, and I'm concerned it's coronavirus. And you hold up and you say, geez, no, you don't have coronavirus. But let me go through and ask you some other questions. So there's a lot of value. Is it exactly like in the office? No, but it is. We found the patients that engage in telehealth, either through visual like this or by phone, actually do much better with outcomes. So it's just unbelievable how things have changed in the last few months.
So, what might so let's say I do want to get to my doctor's office. They're open for a particular essential service, or I have to find my way to the hospital. What are the precautions I should take? Again, I agree, and we know we've got a great system that is safe. Should I come with a mask in my car? Should I have my own PPE? Should I make sure that the waiting room might not be filled with people? What steps do you think physicians are encouraged to take, and what advice would you give a patient who might have to present themselves at a ambulatory center or a hospital or a doctor's office?
Well, that's a great question. So first of all, if you're going to end up coming in, you have to take your time, because what we found is, if you rush, you're going to put yourself at risk. You may forget your mask, or you put your hands underneath your mask, or you forget your Purell or something like that. The doctor's offices are in a position to make sure that you're appropriately socially distanced. The chairs are strategically positioned so you're not sitting on top of someone or right next to someone. The registration folks will have masks on, and yes, you will be asked to have a mask. If you don't have a mask, the doctor's offices are in a position to provide one for you, so you're appropriately protected. You don't need full garb, meaning you don't need a gown and gloves. You don't necessarily need gloves either, but you need to keep your hands clean and wash them on a regular basis, especially if you're going out in public.
So, a lot of times patients are uncomfortable, especially I will say in a larger medical group, to sort of ask the question up front. Is it safe to say that when you're calling for that appointment or calling to check in, to ask questions like, what you've described? What's the office setup? Should I be aware that there's someone there? Could I suggest? I mean, what encouragement would you give a patient to be sort of proactive in making sure they even feel comfortable before they leave their house?
Absolutely. Great question. You absolutely need to be your own advocate and ask those questions. Maybe is there a better time? What's the process? Should I come in through the front door or the back door? Should I wait? Many times the offices have some concerns over the number of patients. They may have you wait in your car and call you when you're ready to go in and see the doctor. So there's a lot of strategies that are out there you may not even realize. So that's why take your time, speaking to the office staff, you're going to put yourself in a really good position to have a good medical visit.
You're not at all intimidating, but maybe somebody else is, and the physician. Sometimes the patient doesn't like to step out of line, so asking those questions I think could probably be very, very helpful. We're going to encourage you, if you have a question, to add to the comment under the live stream. Dr. Begg's with us for a few more minutes. And Doctor, I want to offer, on behalf of the nearly 300,000 people who call Dutchess County home, we have a great healthcare system here in Dutchess. We're very grateful to our partners at Mid-Hudson Regional, and of course all of our partners at New Vance. I am, as you likely know, a little bit partial to Northern Dutchess Hospital, and it's not because I like Denise George the most, but it's because I'm I live in Red Hook, so I'm close to Northern Dutchess. But I will offer to you that all of our partners at New Vance, Vassar Brothers, of course, where you are, Northern Dutchess Hospital, and your partnership with Putnam, we've been treated quite well, and the partnership and the collaboration we've seen over the course of this exercise, this pandemic, this crisis, has just been remarkable, and we're very, very grateful for not only all of you, all of those in decision-making capacity, but also, of course, those on the front line. And I had the benefit of being with some of the nurses last week with Mayor Rollison and others to celebrate Nurses Week and the recognition of those nurses. But I will offer to you that it's just it was a moving and an emotional tribute to people who I think on any given day might not consider themselves heroes, but in every way these last several weeks have certainly acted and performed as heroes. So we all appreciate that.
Thank you so much. And I will say, when I look back 10 years from now on what I remember the most, what I'm going to remember the most is how much we all pulled together. We broke down those barriers, whether you're from one medical center or another, or either from one part of town or the other, how we put aside our differences and we truly did what was best on behalf of Dutchess County. And so for that, thank you for your kind comments, County Executive.
I believe that. I think the one lesson throughout this experience has been how valuable leaning on one another emotionally, virtually, and eventually physically truly is. We did get a question directly for you, so I'll ask it. A lot of obviously family members are concerned about having to send a loved one in for a surgery or a procedure. I'll mention, to the extent perhaps you may want to, also like birthing and deliveries. I know there of course there have been restrictions on family members. What advice at this point would you give someone who's asking specifically, if loved ones can accompany a family member to a procedure or to a surgery or appointment?
That's a great question. So if somebody is coming in for a delivery, we are allowing a family member, and if it's a pediatric patient also, common sense dictates that we allow family. For surgery, we want the loved one to collaborate. There's restrictions on where you can actually assist us, and the traditional visiting is not allowed still. In the state of New York, there's a few very small pilots going on right now to see how we can best have visitors come back. I will say we're not just turning the switch and start operating 100%. Whether you're here, Mid-Hudson, or Northern Dutchess, we're slowly starting to offer operations for those who need it most emergently or those who are not at risk for staying overnight. But we do understand your concerns, and we want your feedback so we can have you and your family members have a better experience and stay safe.
I can tell you firsthand, while my father was at Westchester Medical, the professionals that stood between us and him trying to communicate our concerns for him to him and vice versa, it was it was a remarkable exercise. Believe me, I was very grateful and very impressed, but it was also somewhat surreal. So I know you know that that feeling that people have sending a loved one off and not necessarily being able to be with them.
Agreed.
So we're also a direct question about elective surgeries, whether they're allowed at doctor's offices and surgical centers. Do you want to talk a little bit about what you know is now permitted? I'll fill in if you don't, what's permitted now in the county and what people should expect at an ambulatory center or the hospitals relates in particular to those elective surgeries and procedures.
Yeah, so we just reopened the opportunity for some elective surgeries as of last week. And we started out again with the lower acuity surgeries to make sure that we weren't overwhelming staff or services. And this week, we're starting to slowly ramp up additional services that are elective. If somebody needed a hip replacement or knee replacement, that's a big surgery, but it's not emergent. So those, we're not in a position to do those just yet. There are some walk-in centers or ambulatory centers, not necessarily associated with Vassar Brothers. We're also starting to do some elective procedures. So it's a slow ramp up. And County Executive, you can highlight maybe other medical facilities that have been doing similar.
Well, yeah, you've kind of covered the basics. We now are permitted for basic elective necessary procedures at ambulatory centers and hospitals. I also want to offer to you that we did get a lot of, not that this is your area of expertise perhaps, although I don't want to assume, but we received a lot of questions about dental services, and of course traditional dentists and dentist services not necessarily permitted at the moment, but anything that's essential is. So an emergency-related procedure at a dentist office is still, but you just would have to find someone to provide that. Doctor, this is actually, this is a really good question that I'm, if you want to take a stab at, and I don't want to throw it at you, it's more of a, a personal choice and policy kind of a question. But if older residents haven't been out in public for a while, should they be worried about sort of just jumping out there into the community, or should they take measures and steps to kind of be a little bit more cautious? That's the direct question. If an older person hasn't been out in public for a while, should they be worried about the germs?
So if you follow protective strategies, you're going to be fine. Which means if you're out in public, you should wear a mask and you should wash your hands. Some of the areas where people may not think about, if you have a mask on like this, and you start putting your hand under your mask, you've just ruined the whole purpose of having a mask on. If you have your mask off and you're biting your nails, or you've ruined the whole routine. So quite honestly, the biggest risk for our folks who are seniors is not going outside. It's having someone come in and help you who doesn't have a mask, doesn't wash their hands. I actually lost an uncle because of that. Had Parkinson's, having someone come in to help him. He never went outside, but he died because the healthcare or the aide had coronavirus. So you're fine to go outside as long as you maintain your social distance, wash your hands, and keep a mask on. I will say that while overall the trend has been downward, we see a mini bump every week. So on the weekends, when people go out a little bit more, on Friday, Saturday, which is 5 days later, we see a little bump. So those folks that are not socially distancing on the weekend, not wearing their masks, not washing their hands, every 5 days later, we see a little bump. So whether you have you're along in years, or you have medical problems, or what have you, everyone needs to follow the same precautions.
I'll throw this at you, and you can choose. You could throw it back at me if you don't want to necessarily dive too deep in it. But there are those who say, "Listen, you didn't have such. You have 525 beds of hospital beds in Dutchess County. You only at one point only had 125 people, 140 people in the hospital. Why did we have to shut everything down for that?" And then in the same respect, as we reopen, right, people were saying, "Well, if you have 525 beds and we never had more than 150, what's the concern?" Do you want to jump at that a little bit?
Oh my God, I'll absolutely take that. If anyone's bored and you want to watch a great flick, there's a 40-minute video that's called the 1918 Spanish Flu. And it shows what two cities did in 1918. In St. Louis, they had all the precautions that we're having, and they came out doing really, really well in the fall of 1918. Philadelphia, they said, what's the big deal? They had their Labor Day parade, this, that, and the other thing. What the difference was, St. Louis, a few people died, that's it. In Philadelphia, the bodies were stacked so high they didn't know what to do with them. Thousands of people died. The problem is that the healthiest people, the younger folks, the ones who have no medical illnesses, they're the ones that are carrying the coronavirus and not symptomatic, and they're giving it to the people who are older in years and already have medical problems. So it absolutely makes a difference. And so if you're young and healthy, you actually have more of a responsibility not to be cavalier, because you're going to be affecting your mom, your dad, or someone who has a medical problem. So a couple things for you to consider.
So I'm going to come right back at you, because someone right now is likely typing on the screen that says, yeah, but what about Georgia? They're open, they saw a little bit of a spike, and now everything's fine. What do we know? We don't know enough about the disease, but why should we not necessarily let our guard down entirely? Because we've seen now, of course, the Commissioner of Health is our Commissioner of Health and Infectious Disease Doctor Wythe, and he could answer this as well. And I don't want to throw it at you, sort of as a sandbag. But someone's saying, hey, listen, they open the beaches, Florida's safe. Why are we so worried?
Well, there is a difference. And I wouldn't say we would ever let our guard down. What I would say is each state is a little bit different, and they're opening at a different level, a different rate, phase 1, phase 2, phase 3, 4. If you think about it, the difference between us and Georgia, New York, and especially the greater New York City area, we represent 10% of the world's coronavirus patients, not of this area, and 10% of the deaths. Georgia and other places, they have some cases, but they didn't start out in a place like us. Again, we've had thousands and thousands of deaths. Each day in New York State, we still have 175 deaths. So it's still much different. I don't think we should ever let down our guard. And I do want us to start reopening things using all the protection that we have, because it's good for us and it's good for our county.
So I will tell you, and I'm going to keep you just for a couple more minutes. I know that, one, we want to get to some other non-hospital related questions, and you do have a tight schedule. But I will tell you, our staff discusses these topics with the healthcare community daily. Once a week, we have a similar call with the leadership of all of our hospitals. And as we talk about this desire to reopen, and believe me, we have these conversations about, we want to get to that next phase. The hospitals are very good to warn us that, our system here is good, very good quality, but not the biggest of depth, meaning capacity. And even within the hospitals, right, not every room is necessarily prepared to handle a COVID patient in every wing. So you shut things down in order to contain the infectious disease, and that limits capacity. Is that fair to suggest? So the goal here, of course, is as we incrementally reopen, we just, we don't want to flood the gates, and that really is the concern for hospitals. That's
a great point. And while we're starting to reopen things, the reality is that our hospitals are not operational as we were back in February. We still have floors that are shut down. We still haven't done many hundreds of operations. So that's why we want to slowly reopen, so we can actually not only provide service to you medically, but also we need to have a little bit of a buffer of a few open beds in case, God forbid, we have a spike again.
Well, let's do this. I first want to advise our viewers that you are not in a remote location. You're actually seated separately in the conference room here. And the only reason I say that is because we obviously wanted to keep social distancing. But I also say that because you're seated in front of an piece of artwork that usually elicits a lot of questions. It looks like an abstract painting, and it is provided us actually by the Anderson Center for Autism students who... at our request, we commissioned a piece of artwork that we had them prepare for us. It hangs in the conference room as a reminder that everybody has the ability to achieve something, and these artists who live and participate at the Anderson Center, were kind enough to share that with us. I just wanted to say that because it always elicits a lot of questions. But if you would like, is there one last thought you might want to offer the broader community about returning to a sense of normal, and again the value of contacting your physician, make sure you feel comfortable, but also that you should feel comfortable with the depth of and the capacity of our healthcare community.
Yeah. So I want to thank you for the opportunity to come today. Within medicine and your county leaders, we absolutely want to reopen the county. We want you to get as close back to normal as we can. We also want you to stay safe and seek medical care where appropriate. So feel free to reach out to your doctor, to your medical community, to your hospitals, and feel comfortable that we have absolutely been diligent about developing practices to keep you safe going forward. And so with that, I want to wish everyone the best of health. Good luck, and like I said, we in Dutchess County, our medical centers and professionals are here for you.
You're doing tremendous work, and we're very, very grateful. Thanks. Be safe and enjoy what we can this holiday weekend. Thank you.
Thank you.
We appreciate Dr. Begg joining us. Why don't we jump back to what questions we do have? I know that we have a handful. Why can, Jason, standard, I've heard this question many times, why can major big box stores be open but not other retailers? First, I want to be clear that the essential, non-essential business designation was made by the state of New York. Now, the big box stores, if you're simply a retailer, they're not supposed to be open except for delivery. However, if they have a grocery store or a pharmacy component, they can be open because the grocery and the pharmacy store components are deemed essential, and therefore they are open. And I just would offer that here in Dutchess, we have the ability, certainly, small retailers can can operate delivery service. That delivery can be to a home or to a resident in a vehicle. But any retailer in the county can operate a single employer, single employee over the phone or some sort of virtual purchase, online, what have you, and then deliver that product. Once we get to phase one, there could be a little bit greater latitude there, but delivery is permitted, and delivery is not clearly defined, so it's to a residence or to an individual perhaps in a parking lot, but it can occur in that way. Still no curbside, but you can have that process. You can engage in that. Jesse asked about when nursing homes are allowed to have visitors and family members. I don't have that answer. I know it's a real challenge, and it's a real difficulty and a great deal of anxiety for family members. Our nursing homes are doing the very best they can to provide for care, and I can tell you that that issue of welcoming family members back is the biggest challenge, because, as the doctor just mentioned, the goal here is not to bring the disease from the outside in and to further complicate and perhaps threaten or put at risk those who are most vulnerable. Karen asked how the county determines how many cases are recovered. Great question, because there's not a definition for recovered. That is, after a certain period of time after symptoms subside, you are deemed recovered. And so and again, the absolute numbers I don't recall off the top of my head. We'll get you that. But after a period of time asymptomatic, or after that quarantine period is completed, you're deemed recovered. But as we know, that definition is not medically appropriate. It's simply that's the accepted protocol and guidance. What phase will government offices like small claims courts be opened? First, keep in mind that some of our courts, our larger courts, are doing online or virtual, and of course, in the criminal court, there are processes and procedures still underway virtually. That said, the state hasn't advised what phase courts are in. However, in those communities that have begun phase one reopening, I can tell you that some of those courts are beginning to open in June, so that would be a 3-week window from the beginning of phase one to when the courts are starting to reopen. And I'd offer to you that we should probably likely experience something similar, which is we begin phase one and then perhaps 2 weeks thereafter, but we haven't seen that identified yet. Todd's asking about tattoo shops and parlors. Believe me, I know that Mike Boyce is watching, and I know that he wants to open, and I know that if somebody doesn't tell him he can open soon, he's going to try to do it on his own. What I would say to you is, please, we're almost there. We believe that tattoo parlors, salons fall in that professional services category, which is phase two, again with restrictions, but the state has not said which yet. Jesse asks about skate parks opening as low-risk parks. The answer is no, not yet. However, parks in the county are open. You can visit any one of the county parks. I probably should mention that there are opportunities we're encouraging. You could still do takeout from any restaurant. We've encouraged municipalities to open up parks and make sure at their parks they have picnic tables or available space for folks to take a meal. Dutchess County parks are open. You'll see when you get to any one of our parks, Wilcox or Bowdoin. Those are our big public parks. We've designated on the lawn areas where you can dine on us. So get a meal at one of your local restaurants, do takeout, and you can sit and socially distance and enjoy a meal there. But our parks are open this weekend, Memorial Day weekend. Some community lakes will be open, and you'll want to visit your town, village, or city to see if they're open. I'm not going to get into the medical reason why that seems safe. I will only tell you the goal here is to encourage social distancing. We don't see the kind of rate of transmission of the disease in a water setting, so that's one of the things that they're paying attention to. And some communities have decided to move forward with opening their lakes or their ponds, and that is permitted under the state restriction. How many people are allowed in your backyard for Memorial Day? This is what I will tell you. We want to limit the size of those groups. Basically, what has been said is up to 10 outside of the household, and that would assume, right, you have your household. I'm not going to be the guy who tells you can't have 12, and I just would ask you to kind of keep those numbers minimum. Many have encouraged, if you know that your neighbors have kind of treated the precautions the same way you have, there's nothing wrong with, so long as you all feel safe interacting in that way. You want to social distance to the extent you can. You should have face coverings available. But again, gatherings up to 10 people are permitted for Memorial Day, and in your private backyard. Just try to attempt to keep it to a minimum. Obviously, you don't want to flaunt it. You don't want to invite over 50, 100 people, because that could cause, a problem for them. Could cause a problem for you, too, if someone gets ill. And as importantly, we want to be sure that we're not transmitting the disease and causing problems for people's health. Emily asked about larger weddings. That's likely phase 4. So based on what we know, every phase is about 2 weeks. You're talking not less than 8 weeks from now. Phase 4, and even that will come with certain precautions. We've been advising people that, if you're planning a wedding and you want to have a larger group, I would aim for the fall. I think summer's not logical for a larger setting. Some innovative ways to have weddings. This is my one moment in time to tell you that county executives can officiate weddings. I've actually done about 30 of them as a village mayor, and I think I've only done one. I've only officiated one wedding as county executive. My feelings are not hurt, but if you're interested and you really want to tie the knot and you want to do it during a pandemic, we can do it virtually, which is now legal. And county executives, like mayors and judges, are permitted to do that. So anyway, colleges, Lisa Marie, we're talking. In fact, we had a call this week with our college presidents. We've organized a team of people who are working together to identify a process by which our schools, our college and universities would begin reopening for the fall semester. We're hopeful that the Culinary Institute will have some access to their spring and summer trimester, but we're still working on those procedures and awaiting some state guidance. But we are working very aggressively to make sure there are appropriate plans. Edward asked about what phase he'll be able to visit his son at a group home. I want to get you better direction on that. If you're living in a residence, meaning an individual home setting, I don't know what the entire precautions are. It would seem to me that certainly, well, I don't want to. I mean, certainly, I guess you could visit from a distance, right? I just know, obviously, having a child who lives on the autism spectrum, I know the limitations of that. But it's not identified in any phase, and I would guess it's very similar to sort of visiting in the hospital and nursing home setting, and that's not a direction the state's given out yet. But if you have some specific question or we can provide some assistance, visit thinkdifferently.net, thinkdifferently.net. Tony Schiaffella, our Deputy Commissioner for Special Needs, be happy to try to provide you some guidance and direction. We'll work with you on that. What phase do gyms fall under, Tara? I hope that I was hoping that they were on phase 1. They are not. We expect that gyms are more like phase 3, and perhaps even into phase 4, that recreational component. I would expect that when they open, you should expect some capacity changes, limitations, and likely, at least in the short term, some face coverings. I will encourage you that if you're going, when you finally do get to the gym, a looser face covering around your face is appropriate so that you don't necessarily cause yourself a bit of a problem breathing. We have a number of gyms. Believe me, I want to get to Mike Artega's. He likes when I say Mike Artega's out loud, but whether it's Gold Gym, All Sport, Planet Fitness, Mike Artega's, or any number of our smaller gyms, Fit Social, and a number of the smaller gyms. Obviously, there's a value to getting those open again, but those are one of the areas that will cause us the most concern. Sherry, are we looking for 9 days till we open? No. No, we are not. We are inching very closely. I would say to you right now, the region is likely within the framework of hitting, except for the contact tracing numbers, which will come in last. We're 5 of 7 of the total. I was told today that that includes the contact tracing or not. I don't know that it does. So the 5 of 7 that they've identified for us are, let me make sure I have them. We're still trying to attain the decline in hospital-related deaths. Otherwise, we're at 5 of the 7. So that's what we're waiting for. Contact tracing and then decline in hospitalization. So if you assume that we will get to the contact tracing, we're at 6 of 7 when you make that determination. It is possible that our hospital-related deaths could drop below 5, which would make us attain that particular metric. So we're hopeful within a very short time we'll be there, and it's not going to be 10 days. What about public pools? Pools not approved yet. I would expect that they may have. There will be the capacity for them to be open this summer, but not right now. We're waiting for state guidance, but we would be willing to permit those with those basic guidances. Oh, Mary's asking about the Dutchess County Fair. Don't have an answer yet, Mary. There is no human being who lives in Dutchess County who would want two things to happen more than me, and that is the Renegades to have some semblance of a baseball season and the Dutchess County Fair to open. When and if they make that decision, I can tell you we're working with them, the Agricultural Society, and so I'll make this public plea to our friends at the Agricultural Society. For 174 years, the Dutchess County Fair has provided some family memories. We think even in the midst of this pandemic, we have the opportunity to provide some family memories, we hope, this year. It won't look like the fair, it won't feel like the fair, but there's still that opportunity to provide that support, that event, that activity. It just we don't have an answer as of yet. If we have 10 family members living in our house, can you have friends join you? I am not going to play hall monitor. If you have 10 family members and you all live in the same home, that is a family unit, and therefore, in my book, doesn't get counted against having some friends over as long as you keep it to a minimum. And we mean that. I mean, honestly, there was an experience here in the city of Poughkeepsie where they kind of flaunted the numbers, and all of a sudden you had 100 people. But we're not the hall monitor. Just keep it to a minimum. Slow that transmission. Engage in social distancing. If you have neighbors or friends who you know and trust, and you both trust, have not been out and about and sort of flaunting it. I mean, if I had a neighbor who was working in New York City every day, I will be honest, don't know that I'd invite them over, or at least have them stay at the other end of the porch. But if you're in a community unit and you know each other, keep it to a minimum, and certainly engage as you see fit, but keep it to a minimum. Debbie's asking about real estate. First of all, real estate can be open now. You just can't have in-person activities. You can do that virtually. Real estate, we believe, falls in phase 2, which are professional services, and that we think, again, would be phase 2. Want to cover a few things for you. We want to recognize those as we close today. Recognize our first responders. This is EMS Week, May 17th through the 23rd. We are blessed and very fortunate to have very many career and volunteer first responders in our EMS community. We're very grateful to all of them for the great work that they do, and you'll see them, I hope, along our parade convoy. Number 2, I want to acknowledge that obviously we're all under a great deal of stress. Many people have obviously fear and anxiety, and that's understandable. And I want to encourage you to reach out to our mental health services here in Dutchess County as we acknowledge May is Mental Health Month. You can call or text our helpline at 845-485-9700, 845-485-9700. And we have professionals 24 hours a day, 7 days a week. And I'll close by telling you that, a lot of times we have a tendency to ignore our mental health, mental wellness, and that could be you're just overwhelmed. You've had your kids home for the last 70 days. And there's moments where you feel you're going to break. It is okay to be seated in the corner of that laundry room, hoping for just a moment of peace, and you pick up that phone and call or text us. We're there. It could be 1 in the morning or 1 in the afternoon. You want to talk through the day you had and the challenges you faced, or you're worried about whether or not you can make ends meet and pay those bills. We are here for you to reach out to us, 845-485-9700. And let me close today by thanking you for your patience. I appreciate the fact that we are all going through some very challenging times, some more than others, without question. And if nothing else, as we enter and approach this Memorial Day weekend, it's going to be very different how we celebrate, but we should still celebrate the fact that in this country, many men and women have served us in so many ways, and some have never came home. And in sort of an act of their last mission, if you will. It's our job to find some way to pay respects and tribute. And, I've often thought Memorial Day, even though we often celebrate with big parades and activities, the truth of the matter, that is the most solemn of our holidays. And perhaps in the solitude of these restrictions, we might find ways to celebrate those men and women in the most special and solemn of ways. They deserve nothing less from us. So in the meantime, be safe, stay healthy, be kind, and we'll see you again on Friday. Thanks very much.